Hi there, my name's Sarah Bass. I'm faculty in public health at Temple University in Philadelphia, and I direct the Risk Communication Lab here. We're using some commercial marketing techniques to understand how people make decisions about their health. I want to talk a little about that based on a study my team did looking at perceptions of participating in clinical trials in minority HIV patients. This article was published in the journal AIDS Care in November 2015. Clinical trials are important to understanding medication efficacy and side effects, but minorities, especially minority women, don't participate in them as often, even though they're disproportionately affected by HIV. This is an important disparity because medications may act differently in different groups, and without representation in clinical trials, treatments may not work the same way. We wanted to see if we could understand how minority HIV patients feel about clinical trials and whether there were differences in men and women by using a commercial marketing technique called Perceptual Mapping. This method uses multidimensional scaling analysis to develop three-dimensional models of decisions. The software that we've developed here allows us to ask very basic questions, and respondents just have to respond saying how much they agree or disagree with something. Then the software takes all of those responses and creates a map that shows how all the concepts relate to each other and to the respondent. These maps are like looking inside the mind of someone. In fact, we can make a perceptual map for one person, or we can make them for a group of people. We can also compare maps across different population segments. We can also plan messages based on the maps. This is called vector message modeling. We can look at a map and figure out how to get that person or group to move in the space towards the decision we're interested in. This allows us to really focus on the 2 or 3 things that might be important to the group, instead of trying to get all things into a message. This way, we're highly targeting the message, just like an advertiser might. But in this case, we aren't trying to sell soda or cereal. We're trying to sell a health behavior or a decision. For this study, we surveyed 50 minority HIV patients who were being seen at a comprehensive HIV clinic at Temple University Hospital. All participants were either African American or Latino, or reported they were mixed race. All of them were asked while they were waiting for their appointment if they were willing to be in the study. And if they were consented and then given a brief tutorial about clinical trials. The survey we used had a series of statements that we asked people to respond to using a 0 to 10 scale. A 0 meant that they strongly disagreed with the statement, and a 10 meant that they strongly agreed. The statements covered both benefits and barriers to participating in clinical trials, and was informed by a set of focus groups we had done with minority patients, so we knew which issues to include. We then ran perceptual maps and vector message modeling for all the respondents, and then did separate maps for both men and women. The results were really interesting. If you look at the maps, the group's self-variable is illustrated in the maps as a cylinder shape, and the star shapes represent the likelihood of participating in either a medication or behavioral clinical trial. The other shapes represent specific barriers or facilitators to participation, and if the shapes are the same, it connotes that the group conceived of those things as similar to each other. The maps show us a few things. First, minority HIV-positive men and women have different perceptions about barriers and benefits to clinical trials. For example, men are less likely to say they would participate in either a medication or behavioral trial and express distrust of the medical system. They were also concerned about being experimented on and doubted the origin of HIV. They didn't feel they had enough information about clinical trials and were concerned about getting a placebo and about their HIV status getting out. Women, on the other hand, were more willing to participate in either type of trial and were more concerned about medication issues, such as losing the stability of being on a current medication or being worried that a new medication may not work for them. With these differences, the messages about why participating in clinical trials is a good thing would need to be different for men and women. Messages for men would have to focus on HIV conspiracies, feeling like they were a guinea pig, and the issue of getting a placebo. They would also need messages about the support of family and friends, and reassurance that their trusted doctor would be part of the trial. Messages for women would have to focus on their concerns about placebos too, but also emphasize the need for more information about clinical trials and the risks and benefits of participating. They would also need reassurance that their doctors recommend it and that the doctor would be part of the trial with them. So what does all of this mean? Men and women clearly have different ideas about clinical trials, and interventions aimed at increasing their participation will have to take these differences in account. Often, the needs of women are not addressed in interventions, with the focus instead on more general barriers. They use the one-size-fits-all approach. But the perceptual maps show clearly that this approach is not going to benefit men or women specifically, diluting the power of the intervention. More targeted message strategies are needed to really motivate people to participate in clinical trials. That's it for now. If you're interested in our methods, please pay a visit to our website, http://sites.temple.edu/TU-RiskComm-Lab. Also, like us on Facebook and follow us on Twitter at TU-RiskComm-Lab.